Arthritis is the swelling and tenderness of one or more of your joints. The main symptoms of arthritis are joint pain and stiffness, which typically worsen with age. The most common types of arthritis are osteoarthritis and rheumatoid arthritis. Hi everyone, welcome back to Living a Balanced Life with Julio. On today's episode, we're going to talk about arthritis, the most common types of arthritis, and how you can use lifestyle management, weight management, and following anti-inflammatory diet can help you live comfortably with arthritis and reduce pain. If you're interested, please stay with me.
Exclusive.
Arthritis is a term used to describe a group of over 100 diseases characterized by inflammation in the joints or other areas of the body. Inflammation is a medical term that describes redness and swelling which causes pain. When in the joint, can also cause stiffness. Left untreated, inflammation can lead to significant and often irreversible damage to the affected area, resulting in loss of function or even disability. Arthritis can involve almost any part of the body, most often affecting the hip, the knee, the spine, and other weight-bearing joints, but also found in the fingers and other non-weight-bearing joints. Some form of arthritis can also affect other parts of the body. Arthritis is a chronic condition. That means that it affects people on an ongoing basis, constant or recurring basis over months, years, even lifetime. Arthritis can also be an autoimmune disease that attacks the whole body, including the internal organs such as your eyes, your kidneys, your heart, and the lungs. There are different types of arthritis, and the most common ones include osteoarthritis, rheumatoid arthritis, lupus, gout. These are all examples of arthritis. Osteoarthritis is the result of the body's failed attempts to repair damaged joint tissues. The joint tissue could be damaged due to injury or it could be damaged due to deterioration associated with aging. Osteoarthritis leads to the breakdown of cartilage, which is the tough elastic material that covers and protects the end of every bone. And the result causes a bone-to-bone contact, which causes pain, stiffness, swelling, and reduced range of motion in the affected joint. The joints most commonly affected by osteoarthritis are the knee, the hip, and those in the arms and spine. Some of the risk factors that can lead to a person developing osteoarthritis include age, obesity, your sex, occupation, participation in certain sports, history of joint injury or surgery, and of course genetics. Some of the symptoms of osteoarthritis include joint pain, achiness, or stiffness that is triggered by specific physical activities such as running, walking, or stair climbing. If you have joint pain, aching, or stiffness that starts gradually and usually comes on with a high impact of physical activity, or you may have osteoarthritis if your pain is triggered by ordinary activities and relieved by resting that joint. That could be an indication that you have osteoarthritis, and it's important for you then to make an appointment to see your physician to get blood work done to check the affected joint to get the proper diagnosis of osteoarthritis before taking any medication over the counter to treat it. Osteoarthritis affects about 3 million Canadians. This occurs when the cartilage begins tearing away. And this cartilage is very important to act as the protector of the joint to absorb shock and enable the joint to move smoothly. So a person is diagnosed with osteoarthritis when they have bone-to-bone rubbing because the cartilage is damaged. Rheumatoid arthritis is the other form of arthritis. It's a chronic inflammation disorder that affects more than just your joint. In some people, the condition can damage a wide variety of body organs, including the skin, the eye, the lungs, the heart, and the blood vessels. The inflammation that's associated with rheumatoid arthritis is symmetrical, so it affects both sides of the body. About 40% of people who have rheumatoid arthritis also experience signs and symptoms that does not involve the joint. Rheumatoid arthritis can affect many non-joint structures, including your skin, your eye, your lungs, your heart, your kidney, your salivary gland, your nerves, your bone marrow, and blood vessels, because this is an autoimmune disorder. The signs and symptoms of rheumatoid may vary and may even come and go. periods of increased disease activity, which is called the flares, and also there will be period where people don't experience that much pain, which is the remission. When the swelling and the pain fade or disappear over time, rheumatoid arthritis can cause joint to deform and shift out of place, and this can lead to disabilities. Factors that may increase your risk of rheumatoid arthritis include your sex. So women are more likely than men to develop rheumatoid arthritis. Age can occur at any age, but most commonly begins in the middle age. Family history. So if a family member has rheumatoid arthritis, it increases your risk. Smoking and other environmental exposures can increase a person's risk of getting arthritis, as well as obesity. So people, especially women age 55 and younger who are overweight or obese, appear to have somewhat higher risk of developing rheumatoid arthritis. Can lead to many complications that can affect the whole body, because rheumatoid arthritis is an autoimmune disease. So osteoporosis is one of the complications of rheumatoid arthritis, can increase your risk of a condition that weakens your bone and makes them more prone to fracture. Rheumatoid arthritis can lead to rheumatoid nodules. These are firm lumps of tissue, most commonly form around pressure points such as your elbow and your knee. It can also be formed anywhere in the body, that including the lungs, and this can cause a lot of pain for a person suffering from it. Dry eyes and mouth are also a complication of rheumatoid arthritis. Carpal tunnel syndrome is also a complication of rheumatoid arthritis. If rheumatoid arthritis affects your wrist, the inflammation can compress the nerves that serves most of your hands and fingers, and this can lead to pain that is associated with carpal tunnel syndrome. Rheumatoid arthritis can lead to other heart complications, which can cause hardening and blockage of the arteries, as well as inflammation of the sacs that encloses your heart. So rheumatoid arthritis can affect the heart, it can affect the lungs. People with rheumatoid arthritis have an increased risk of inflammation and scarring of the lung tissue, which can lead to progressive shortness of breath. Rheumatoid arthritis is associated with many forms of cancer, including lymphoma. So when you have rheumatoid arthritis, because of the inflammation, there's a high chance of a person developing many types of cancers. But the good news is that when you have rheumatoid arthritis or osteoarthritis, you can use lifestyle management, including weight management, exercise, and eating healthy, balanced diet, and anti-inflammatory foods that can help you stay healthy to prevent the complications that's associated with arthritis, to help you live a full, functional life. If you think you may have any form of arthritis, especially rheumatoid arthritis, it's important to make an appointment to see your healthcare provider, where they will check your joint for swelling, redness, and warmth. They will also may send you for blood work to look for antibodies that may be in your blood to indicate that you have autoimmune disease, and imaging tests like X-ray or CAT scan or MRI, ultrasounds. These are all ways for your doctor to help diagnose if you have osteoarthritis or rheumatoid arthritis, or sometimes to differentiate them and to give you the appropriate treatment and medication that you may need. Arthritis treatment and management include focusing on relieving symptoms and improving your joint function. You may need to try several different treatments or combination of treatment of medication before you find what works best for you. If you're diagnosed and you're prescribed medication and it doesn't agree with you, it's important for you to go back to your doctor and have them reassess the medication, because there's so much different medication on the market that help you treat the joint, to stop the damaging and deformation of your joint, and to help relieve pain so you can live a functional, normal life. Besides medication, there are other lifestyle modification that you can include into your lifestyle that can help you improve the symptoms and complications that's associated with arthritis. And they include, of course, exercising, healthy eating, and of course not just healthy eating, but focusing on the foods that boost your immune system and also prevent inflammation, because inflammation is the major pain-causing factor in arthritis. There are many medications on the market that can help you stop the deformation of joints due to rheumatoid arthritis, and these could include non-steroid anti-inflammatory drugs like Aleve, naproxen, Advil, Motrin. These are all anti-inflammatory medication. There's medication to control pain, which are called the painkillers. These medication can reduce the pain by reducing the inflammation. Example of that could be acetaminophen, things like Tylenol. Remember, whenever you think you have these conditions, it's important for you to speak to your healthcare provider so they can do the proper examination and send you for proper diagnostic tests to help diagnose the condition and give you the medication that you can tolerate. Remember, medication are given based on your blood work, so they're looking at your kidney, your liver function, your kidney function, and all of that before it's prescribed. So refrain from taking over-the-counter medication and make sure you double-check everything with your healthcare provider before you start taking any medication to treat pain and arthritis. Exercise is a very important component of successful treatment plan with arthritis, especially rheumatoid arthritis. Appropriate stretching and strengthening of muscles and tendons surrounding the affected joint can help keep them strong and healthier and effective at reducing the pain and maintaining mobility. It's important to do some aerobics exercise that can help maintain a healthy body weight, and this can lessen the unnecessary strain from the weight on the joints. Swimming, walking, cycling are often recommended and should be done at a level that challenges the person's aerobics capacity. So if you have rheumatoid arthritis, it's important for you to speak to your healthcare provider. If you're depending on what stage you're in, it's recommended for you to see a physiotherapist that can help you with some exercises that can help strengthen your muscle and improve the joints. So it's important to exercise every day. If you're someone that can tolerate about 20 to 30 minutes of aerobics exercise, which walking counts to, and you can afford a physiotherapist or you don't have the coverage for physiotherapists, you can do your own walking every day, making sure you're getting 20 to 30 minutes a day to help you meet the minimum of the exercise recommendation to keep your whole health in check. And then also with same thing with the strengthening exercise. If you're doing strengthening exercise, which is any exercise that you're working with your weight or against your body weight, can help improve your muscle strength and help improve the joints and therefore help reduce the pain. So those kind of exercises recommended for you to do about every other day or at least 2 to 3 times per week. Improve your joints. Exercise is a crucial part of arthritis management. It increases the strength and flexibility, reduces joint pain, and can help combat fatigue. Of course, when you suffer from joint pain and stiffness and you already are in pain, sometimes the thought of walking around the block or swimming a few laps might seem overwhelming, but doing these exercises can help improve your flexibility, improve the strength of your joints. Exercise can help strengthen your muscle around your joint, help you maintain bone strength, give you more energy to get around the day, make it easier for you to get a good night's sleep, and can help you control your weight and enhance your quality of life by improving the balance in your life. Although you might think that exercise may aggravate your joint pain and stiffness, that's not the case. Lack of exercise actually can make your joints even more painful and stiff. It's better for you to do a little bit of exercise every day than to not do anything, focusing only on the pain. The less you move, the more pain your arthritis become, and the more the disability gets worse. Always speak to your healthcare provider who can recommend the type of exercise that fits the type of arthritis that you have to improve your joint motion. Some of the tips about exercises: make sure that you start your exercise slowly so you ease into the exercise and get active. Every little bit of exercise that you do or every little movement that you make makes a difference in terms of improving your bone health, your joint health, and improving the pain that's associated with arthritis. Some of the healthy tips that you can do to make sure that you're protecting your joints to reduce pain while you exercise is to make sure that you do low impact exercise. So low impact exercise includes things like going on a stationary bike, elliptical training, or exercising in water, because these help keep your joint stress low while you move. Also, before you do any exercise, if your joints are stiff and they're a little painful, you can apply heat. The heat can help relax your joint and muscles and relieve any pain you may be having before you begin your exercise. So this is a good way to also make sure that you are protecting yourself. Some people like to take hot shower or warm shower. This helps relaxes the muscle and the joints, and so it makes movement not as painful. Also, when you're moving, you want to move gently, right? You want to warm up slowly, and then you begin your exercise. Range of motion exercise are very important where you're moving your joints to improve mobility and to improve the pain that's surrounding joints. You don't want to overdo the exercise. It's important for you to listen to your body. You might notice some pain after you exercise if you haven't been active for a while. In general, if you're sore for more than 2 hours after exercising, that's an indication that maybe you exercise strenuously. So talk to your doctor or your healthcare provider about what is considered a normal pain for you and what is a sign of something more serious. So take home messages: you want to exercise, you want to be safe, and you want to prevent any damages to your joints and prevent any future strains to your joints. Weight loss can ease arthritis pain and improve the quality of life of adults living with arthritis, especially if they are overweight or have obesity. Losing weight can help reduce the overall severity of your arthritis. Studies have shown that people that lose about 5 to 10% of their current body weight can help improve their overall health, including cardiac disease, diabetes, and of course their arthritis. Studies have found that overweight and obese adults with knee osteoarthritis found that losing 1 pound of weight result in 4 pounds of pressure being removed from the knee. In other words, if the person loses 10 pounds, they will relieve 40 pounds of pressure from their knee. Losing weight is very important for arthritis management, to reduce the pain and to prevent further damage to the joints. So for every pound that a person loses, there is a 4-pound reduction in the load extended to the knee. This means that moderate weight loss of 5% can help reduce pain and disability. And therefore, making sure that you are trying your best to reduce your weight is very essential for arthritis complications. Inflammation is a major part of arthritis disease process, and therefore eating foods that improves inflammation is a good way to help improve your overall health and to prevent the complications that are associated with arthritis. One of the most powerful tools to combat inflammation comes not from the pharmacy, but from your grocery store. Eating a healthy, balanced diet is a major part in arthritis management. Making sure that you're getting all the vitamins and minerals from all the different food groups can help not only improve your arthritis, but improve your overall health. Anti-inflammatory foods are foods that are healthier for you. So all your vegetables, all your grains and starches that are high in fiber, and of course as close to its natural form as possible. So you want to avoid the processed food, because the more processed it is, the more of all the good fibers and all the other component of the grain taken away, and that can feed inflammation and make it worse. So you want to eat healthier foods that are as close to its natural form as possible. Choose nuts and seeds because they are very good for you in terms of they have the good fats and they have all the antioxidant that can stop the inflammation process. You want to choose plant proteins because plant protein once again are high in fiber, meaning that they slow the progression of inflammation and improve your overall health. If you're choosing meat, of course choose meats that are lean, so low fat meat is better for you. If it's things like chicken, remove the skin, remove the fat from it, so that way you improve and slow down inflammation in the body. And all of this can help improve your overall health, not only for arthritis but for other conditions like heart disease and cholesterol, diabetes, and all the other comorbidities that are associated with arthritis. To reduce the level of inflammation, aim for an overall healthy diet, healthy, balanced diet. If you're looking for an eating plan that closely follows this anti-inflammatory eating, consider the Mediterranean diet, which is a high in fruit, vegetables, nuts, whole grains, fish, and healthy oils. In addition to lowering your inflammation, a more natural, less processed diet can have noticeable effect on your physical as well as your emotional health. A healthy diet is beneficial not only for reducing the risk of chronic diseases like arthritis and diabetes and heart disease, but it can also improve your mood and overall quality of life. So it's important to eat a balanced diet so you get all the vitamins and minerals that you need, to improve your immune system, improve your overall health, and to help you live a balanced life. There are many foods that have anti-inflammatory benefit, meaning it helps reduce inflammation in the body. And these foods include ginger, garlic, turmeric, all your greens and all your leafy greens like spinach, kale, broccoli are all excellent sources of antioxidant that help reduce inflammation in the body. Chronic inflammation has been linked to some cancers, heart diseases, diabetes, arthritis, depression, Alzheimer's disease, and so forth. So fighting inflammation is very important for the body, and some of the foods that does this include the fatty fish. So fatty fish are high in the omega oils, which are good for fighting inflammation and improving your overall health. These fish include salmon, mackerel, tuna, sardines. These are all good type of fish to include into your diet. Of course, you want to bake it. You don't want to deep fry it, because when you deep fry the food, it loses all its benefits. So you want to include fatty fish, because that fat is good for your body, is good for reducing cholesterol, and is good for reducing inflammation in the body, and therefore will help improve pain that's associated with arthritis, pain that's associated with other chronic illnesses, and stop the deformation and complication associated with arthritis. Including fruits and vegetables is essential. All vegetables are good for you, but the leafy greens are especially great for its benefits of the anti-inflammatory. So making sure that you're including spinach, kale, collard green, broccoli, all of these are good for you. Of course, all the different peppers that are there. So essentially eat the rainbow, meaning that as colorful as you can in terms of the vegetables. Introduce different vegetables into your diet. If it's agree with you, continue to use them, because it will help you feel full. It will help with weight loss. It can help with weight maintenance, and also help with the inflammation that's associated with arthritis. Choosing fruits like blueberries and strawberries and all the different berries and cherries are all good source of anti-inflammatory and antioxidants that can help reduce pain, reduce inflammation in the body, and therefore improve your health. I've already mentioned nuts. All kinds of nuts are good for you, because the nuts are not only high in protein, but also high in the good fat that can help reduce inflammation in the body. If you're choosing oil to, let's say, for example, dress your salad, choosing olive oil is good for you, because it's, once again, it's the good type of fat. Of course, you don't want to deep fry your food, because once the food hit the oil at that high temperature, most of the quality of the food is depleted. So you want to eat the food as close to its natural form as possible. One way to make sure that you are getting all the different food groups and getting all the vitamins and minerals that you need is making sure that you are following the healthy plate. So if you eat from a plate, make sure half your plate is full of vegetables. Then you have the other half divided into your protein and your healthy grains and starches. And then you can have your piece of fruit. And then, of course, you have your milk, an alternative, which could be yogurt or milk as you prefer. So when you eat like this, it helps make sure that you're getting all the vitamins and minerals from all the different food groups that can help you maintain your weight, help you improve your chronic illnesses like diabetes, heart disease, and also improve arthritis and its complication as well. If you're following a healthy, balanced diet, you might not need to take any vitamin supplements. But once again, people that have arthritis, some of the medication depends on what type of arthritis that you have, can cause depletion of vitamins and minerals in the body. So to make sure to know where you're at, it's important to speak to your healthcare provider, have them do blood work so they can do a workup to see where you stand in terms of your vitamins and your minerals, and then whatever is lacking, either you can get it through your diet, through specific recommendation, or could be supplemented through multivitamins that you can take once a day, or any minerals that's missing in your vitamin according to your blood work. For more information about healthy eating and anti-inflammatory foods, you can watch my other videos on immune boosting foods, which I talk a lot about anti-inflammatory foods, or visit my website livingabalancedlife.com, where you can get more information about healthy tips and how to live a balanced life. Make sure to eat a balanced diet, including all the different food groups, vegetables and fruits, eating all the different colors, eating the rainbow, making sure your food is colorful, because you get different vitamins and minerals from all the different fruit and all the different colors, and this will help you maintain a healthy body, reduce inflammation, and improve your overall health. Include water as your main beverage. It's a good way to prevent inflammation in the body, which will help prevent cancers, help prevent heart disease, improve diabetes if you have diabetes, or prevent diabetes, and improve your arthritis and its complication, and also stabilize your mood and prevent other mood disorders. So that's what I have for you today. If you have any questions, please, you can email me. You can leave it in a comment section under the videos, and I'll respond to your question or comment. If you want more information, like I said earlier, visit my website, livingabalancedlife.com, to get more information on healthy tips and healthy living. And if you have specific question where you don't want to put it under the comment, you can email me at livingabalancedlifeinc@gmail.com. So until next time, take care, stay safe, eat healthy, exercise, all to improve your overall health, to prevent chronic illnesses like arthritis, to live a healthy, balanced life. Take care, stay safe. Bye-bye.
Exclusive.